word. It is another day, another time, another hour, another period in our journey towards that knowledge acquisition, which is very necessary for us to enjoy life in abundance, life in full. Because when you have knowledge, you have power. You have less fear about anything. Health is wealth. Knowledge is power. Acquisition of knowledge is all I am interested in, and that knowledge on earth matters through the understanding of the laboratory. So today I am taking up the flip side of the last topic, which was on obesity. Obesity is feeding so fat, feeding so well in the abundance of many, so much things. Now, the opposite, the flip side of that is where you cannot feed well. That is what is called Kwashiorkor. When you have a situation of no protein, you are not feeding well, your body starts using up all the protein in your body, the energy stored as even as fat. There is no fat again in the body. The appearance of that patient is looking so lean. Even the one of the ways of identifying that person is starving is to take the circumference measurement of the middle upper hand, and that's when you now describe that this patient is likely, or this child is likely suffering from Kwashiorkor or marasmus. These are situations where we are in a famine, or the situation in the present countries like these developing countries, that their leaders are not really taking care of their citizens. So you have high population of people suffering and living on the poverty line. So how do we come to say this person has Kwashiorkor? That is all that I am trying to now do, and that is where the laboratories is involved, and other departments in the health sector are involved. You can even talk of the dietitian, the nutritionist, and all the other health allied professionals. But let us understand what is Kwashiorkor. Kwashiorkor is a situation where you are giving the body nothing to use. The body is like a factory that produces all that we are seeing, the nose, the everything that you want to talk about. And how do you really understand the situation of the human body that is undergoing that starvation, more or less? It is seen on the skin. The skin shows the suffering of that person. That's why it is a common statement in my side of the country, Obelawo. That is, when you look at the skin, you can really talk about whether this person is well fed or is undernourished. The skin speaks volume of your state of health and also on your nutritional status. If there is hunger, if you are really suffering, just that skin exposes your state of health. And I am not in any way going to tell you that that is definitive. The skin is not definitive. There are so many things that the laboratory has to now do to really confirm. As with obesity, where you now take the height and weight, it's the same thing with Kwashiorkor. In Kwashiorkor situation, you are now talking of disease score. In obesity, you are talking of basal mass index. That disease score is from minus to 3, and that is what is looked at. I shall now take you inside the slide study so that we can understand more about Kwashiorkor, and then the laboratory test, or those things that are definitive that you can use to now say that this person is really suffering from Kwashiorkor, or even having marasmus, which is worse than the Kwashiorkor. If you like what you are looking at, if you like what you see, just click the like button, press the subscribe, and obviously you'll be notified. Thank you for listening. Kwashiorkor knowledge and laboratory diagnosis. This is a very typical picture of that protruding tummy, which shows a hepatomegaly, that is a large liver. The definition and facts. Kwashiorkor is a protein deficiency disorder with adequate energy intake. That is WHO. Now, when you look at most of these children, they have other components of the food, but they lack protein. The protein, which is the real building parts of the building substance of the body, and that is where Kwashiorkor shows without a serious problem of very low blood level, that is, the hemoglobin level is low. If you take their measurement of the hemoglobin level, you know it's because protein is very essential in the hemoglobin formation, that globulin. The Kwashiorkor itself was discovered in that name in 1933 by Dr. Cecily Williams, a pediatrician, who described the illness in children where she operated in West Africa, which she called it the local name Kwashiorkor, and that's how the name, but it was easily curable by giving the children milk. So milk contains protein, and you can explain it, but the later work really confirmed that it's a serious protein deficiency disorder. It is estimated that between 1/2 and 2/3 of the world's population suffer from malnutrition. That is WHO finding. Where hunger and malnutrition exist, an unusual large population of babies are born alive, having low birth weight. You can also presume that prematurity is also increased in those areas. So where you find high level of premature birth, so lightweight, they are very light, and stunted growth, and so many health disadvantaged children. Let's go to the distribution. Distribution of Kwashiorkor is mostly found in children and infants in sub-Saharan Africa, Southeast Asia, and Central America, and also in war-ravaged areas during political unrest, drought, famine, wherever there is lack of adequate food supply. It can also be a sign of underlying disease like HIV. Children with protruding hepatomegaly. Symptoms: the change in skin, which I earlier talked about, and hair color and texture, fatigue, diarrhea, loss of muscle mass, failure to grow or gain weight, stunted growth. This is something like it's permanent for those children. They never regain their heights, and you never can know the extent of brain damage that has really happened along the line. The edema of the ankle, feet, and belly, lack of protein will always cause that. The oncotic pressure that will prevent water from passing from the vessels, the blood vessels, to all this area would be lacking, because the protein is what gives that oncotic pressure that you see in blood vessels. Damaged immune system allow for frequent infection. So children who have Kwashiorkor will always have serious infection, worm infestation, serious ones. These are hallmark. You just see that somebody is looking for food, more food to feed well. These parasites are now living living in paradise in such children, perforating their lumen and with serious damages that eventually will result in the death of that child. Irritability. Let's talk about the laboratory diagnosis. Clinicians check for a large liver, that is that protruding tummy, before they check for protein and sugar in the blood test that is done in the laboratory. Arterial blood tests check effectiveness of the lungs. That is to balance the pH, hydrogen bicarbonate balance, carbon dioxide bicarbonate balance. Low sugar level is seen and low cholesterol level. That tells you the serum albumin is also low of it's less than 10 grams per deciliter, and blood urea nitrogen also shows the protein wastage, that is the wasting happening around that period. Blood level of creatinine also is about wasting, is about the protein breakdown. Blood level of electrolytes, potassium, magnesium will decrease. Urinalysis for ketonuria, serious ketonuria, that is acidosis, protein bodies, and complete blood count is also done. The lab procedure involves collecting the blood samples by venipuncture, urine samples collection. Methodology: blood samples are allowed to clot and they're separated. The serum is extracted for analysis using the spectrophotometric method, that is passing it through all this equipment that will read it spectrophotometrically, and the quantity calculated, the concentration calculated. The same thing is done for the urine when you want to calculate the substance that you're looking for in the urine. Histological tests on the skin biopsy will reveal a large amount of melanin and a reduced amount of collagen. Other tests that could be done is anthropometry, that is measuring all the basal mass index, the circumference of the waist, and so on. The Z-score takes account of patient's height, weight, age, gender, and 0 for female, 1 for male, to calculate a score, which is usually between -2 and -3 to indicate severe stunting or wasting. Left upper arm circumference measurement is around 115 and 124 millimeters for this patient. Treatment involves correct fluid and electrolyte abnormalities. These are all the problems that are there, because the measurement of the potassium, calcium, and everything will show that there is low level of these substances that are very useful. Magnesium also very important for the body. Micronutrient repletion has to be done too. Just like we said, those things have already been multivitamin has to be given. Any infection, skin infection, whatever infection, like I mentioned, the parasitemia, parasite infestations, what have you, that has really occupied everywhere because the patient is already immunocompromised. So infections are numerous. So the treatment must include that. Thank you for